Hello everyone, this video is about classification of nerve injuries. Before we get to the classification, let us understand a few concepts that we need to understand it. This is the diagram of a nerve fiber, and this is the axon. Each axon is enclosed in a sheath called the endoneurium. A bunch of these endoneurium covered axons are grouped and covered by a sheath called the perineurium. The outermost sheath covering all of these multiple perineuriums is called the epineurium. Now let us look at Tenel's sign. Tenel's sign is usually seen when an injury causes loss of sensation in the sensory distribution of the nerve. In Tenel's sign, tapping the injured nerve at the site of injury leads to a tingling feeling in the distribution of the nerve. So as you can see in this diagram, when an injured nerve is tapped, the patient feels a sensation of tingling in the distal area that it supplies. Now, on the basis of the criteria that we learnt about before, let's look at the classification of nerve injuries. There are two major classifications of nerve injuries. The first one is SEDDON's classification. According to SEDDON's classification, nerve injuries can be divided into three types: neuropraxia, axonotmesis, and neurotmesis. Neuropraxia is not really a complete damage of the nerve, it's just a block at the level of the axon. And so it recovers very early and by itself. Axonotmesis is a more severe injury than neuropraxia. And in neurotmesis, the axon, endoneurium, perineurium, and epineurium, all of these layers are injured, which makes it the most severe injury out of all of them. Second kind of classification of nerve injuries is Sunderland's classification, which classifies the nerve injuries into five types. Type 1 Sunderland classification is essentially neuropraxia, and Type 5 Sunderland classification is essentially neurotmesis. But under Sunderland classification, axonotmesis is divided into three types depending on the level of the injury. Type 2 Sunderland injury is an injured axon with an intact endoneurium, perineurium, and epineurium. Type 3 Sunderland injury is an injury at the level of the endoneurium with an intact perineurium and epineurium. And type 4 Sunderland injury is an injury which includes the perineurium as well. After discussing the level of injury, let us look at what happens to the Tenel sign in each of these cases. In neuropraxia, Tenel sign is negative. The loss of sensation in a simple axon block is more or less intact. And since the sensations were already intact, there is no question of feeling a tingling sensation in the area of loss of sensation. In axonotmesis, Tenel's sign is positive and it is progressive, which means that as the nerve recovers, the point to be tapped to elicit tingling keeps moving more distally. This is a good sign, as it indicates nerve recovery. In neurotmesis, Tenel's sign is positive, which means that there will be tingling when the injured part of the nerve is tapped, but it is non-progressive, since the point to be tapped to elicit the tingling sensation remains in the same place always. Management of the different types of nerve injuries. Neuropraxia does not require much intervention and it heals on its own. Conservative treatment in the form of splints can be given in neuropraxia or axonotmesis or Sunderland's classification 1 to 3. In neurotmesis, nerve grafting is done using the sural nerve or the saphenous nerve. If the nerve still doesn't recover, a tendon transfer has to be done using the palmaris longus tendon.